quick scene. You wake up, coffee in hand, and there it is, a low, tight band across your forehead. You press your temples and your shoulders tense even more. That morning fight with your inbox suddenly feels personal. Today, we're tackling those everyday tension headaches with a short, safe toolkit you can actually try between meetings.
Yes, that exact feeling. We promise practical, science-forward steps that don't require weird gadgets. We'll introduce a 3-step sensory pairing microprotocol that pairs a cool compress with 2-tone paced breathing and a 30-second fingertip pressure technique. Plus, demos for a gentle peppermint lavender compress and a magnesium-rich nut-free snack. We've got clinicians with us today to keep things safe and clear.
Before we meet our guests, quick housekeeping. If you have sudden severe pain, any numbness, weakness, fever, or a stiff neck, stop this episode and get immediate medical care. Dr. Maya will unpack red flags in a bit. All right, let's say hello.
Welcome, Dr. Maya Ruiz, a board-certified neurologist from a headache clinic. Eli Chen, licensed clinical massage therapist, and Noor Patel, a clinically trained community herbalist. Thank you all for joining.
Thanks for having me. I'll keep things practical. My goal is to help you know which headaches are appropriate for at-home care and which need urgent evaluation. Happy to be here. I'll show simple neck and fingertip techniques you can do seated at a desk. Nothing fancy, just mindful, effective movements. And I'll guide a gentle compress and a cooling spray option with clear patch test steps and dilution ratios so folks can try it safely at home.
All right, outline for listeners. First, we'll explain what's driving these tension headaches, then go over red flags and safe medication basics. After that, movement and fingertip pressure, the herbal compress demo, a compress plus magnesium snack recipe, a full guided 6-minute microprotocol you can follow along with, and finally, a safety wrap. Sound good?
Let's jump into segment 1. What drives tension headaches? Dr. Maya, what's actually happening in the body when we feel that tight band?
Great question. Most everyday tension headaches are muscular and stress-related. Muscles in the neck, scalp, and jaw get tight. That increased muscle tone and reduced blood flow sends pain signals. There's often a loop. Stress tightens muscles, pain increases stress, and the cycle continues. Importantly, these headaches are generally symmetric, a mild to moderate pressure or tightness, and don't come with neurological deficits.
So the pain feels like a band or like everything's being squeezed? That checks out with what I get after long Zoom days.
Exactly. And for most folks, gentle at-home strategies, rest, hydration, posture adjustments, a cool compress, and paced breathing can break that cycle. But there are exceptions, and that's where red flags come in.
Let's move to segment 2, red flags and safe medication basics. Dr. Maya, what should listeners watch for that means stop home care and seek urgent attention?
Go to emergency care right away if you have sudden, severe headache, the worst headache of your life, any new weakness or numbness on one side of the body, trouble speaking, double vision, a fever with neck stiffness, or a headache following head trauma. Also, if your headaches change pattern dramatically or you're losing function, don't wait. For everyday tension headaches, occasional over-the-counter acetaminophen or NSAIDs can be used safely at recommended doses, but avoid frequent daily use because medication overuse headaches can develop. If you're on blood thinners or other significant meds, check with your clinician before taking NSAIDs.
That last part is key. Check with your clinician. From a nutritional standpoint, if folks are thinking about magnesium, whole food sources like seeds and leafy greens are safe for most people, but magnesium supplements can interact with medications and aren't appropriate for everyone, especially in pregnancy or with significant kidney issues. We'll outline specifics in the show notes.
Okay, safety front and center. Now, segment 3, movement and manual cues. Eli, you said you'd show a brief seated neck and shoulder sequence and a fingertip pressure map we can use for 30 seconds. Walk us through it slowly.
Start seated with both feet on the ground and your shoulders relaxed. First, chin tucks. Inhale, gently lengthen your neck. Exhale, tuck your chin slightly toward your chest. Just a tiny motion, not a full stretch. Repeat 4 times. This helps reduce forward head posture. Next, shoulder rolls. Inhale, lift the shoulders. Exhale, roll them back and down 3 times, feeling space between the neck and shoulders. Now the fingertip pressure. Locate the base of the skull, where you can feel a slight hollow just behind the ear line. 2 points, left and right. Use your fingertips, not nails, and apply steady, gentle pressure for 30 seconds total, 15 seconds per side, or continuous alternating pressure. The aim is to interrupt the pain signal, not to force or dig. If you feel sharp pain, stop. Contraindication: if you have neck instability, recent neck injury, or signs of radicular pain down the arms, skip these techniques and consult a clinician.
That fingertip pressure is surprisingly grounding, short, safe, and doable at a desk. Are there any common mistakes you see people make when they try this?
Yes, pressing with the thumb too hard or using fingernails instead of fingertips. Another is holding their breath. Breathe normally. Finally, trying to stretch aggressively. Gentle is better here.
Great. Now segment 4, herbal safety and a compress demo. Noor, how do we make a gentle peppermint lavender compress that's safe for most people? And what's the patch test and dilution guidance?
Start with the base 1 cup of water brought to a simmer. Add 1 tablespoon of dried peppermint leaves and 1 teaspoon of dried lavender flowers. If you don't have dried herbs, 1 peppermint tea bag and a small pinch of culinary lavender work. Simmer gently for 5 minutes, then strain. For a compress, cool the infusion to warm and pour into a bowl. Fold a clean cloth and soak, then wring to just damp. Always test the temperature on your wrist first, so it's comfortable, not hot. For essential oil-based cooling spray, if you choose that route, use strict dilution. For a 100 milliliter bottle, add no more than 6 drops total of essential oil. For example, 4 drops peppermint, 2 drops lavender, in a carrier like witch hazel or distilled water with an emulsifier. But I want to stress, many people can react to essential oils. Always do a patch test. Put a small drop of your diluted mix on the inside of your forearm, wait 24 hours, and watch for redness, burning, or raised skin. If anything appears, stop using it. For non-herbal cooling, chilled gel packs wrapped in a cloth work just fine.
Noor, you mentioned alternatives for those with sensitivities. Could someone use plain peppermint tea bags after cooling, or even cucumber slices?
Absolutely. Cooled peppermint tea bags are gentle and very accessible. Cucumber or a clean, damp cloth from the fridge are great non-herbal options. The point is a cool, soothing sensory cue, not a skin irritant.
Perfect. Segment 5, recipe, compress plus a magnesium-rich, nut-free snack. Somnang, lead the compress prep steps slowly so listeners can follow. And Noor, chip in on substitutions.
Step 1. Pour 1 cup of water into a small pot and bring it to a gentle simmer. Step 2. Add 1 tablespoon dried peppermint or 1 peppermint tea bag plus 1 teaspoon dried lavender. If unavailable, skip the lavender and use a pinch of chamomile instead. Step 3. Lower the heat and simmer for 5 minutes. You'll smell the herbs, minty and floral, very calming. Step 4. Turn off the heat, let it cool to warm, then strain into a bowl. Step 5. Fold a clean kitchen towel. Soak it with the infusion, wring so it's damp, and test on your wrist. If it's comfortable, place it across your forehead or the base of your skull for up to 10 minutes.
Allergy swaps. If you're allergic to mint or lavender, use chamomile or just plain cooled green tea. For essential oil users, remember the earlier dilution and patch test. And if you're pregnant or breastfeeding, check with your clinician before using concentrated herbal extracts. The compress with simple tea is usually safer, but always confirm.
Now the magnesium-rich, nut-free bite, recipe and substitutions. Samnang, read ingredients slowly so listeners can jot them down.
Ingredients for 1 small batch: 3 tablespoons pumpkin seeds, 2 tablespoons sunflower seeds, 2 tablespoons oats, 1 tablespoon tahini or sunflower seed butter for a nut-free option, 1 tablespoon cacao nibs or dark chocolate chips, a pinch of sea salt, and 1 tablespoon maple syrup to bind. Optional, a teaspoon of ground flax or chia for extra texture.
Nutritional note: pumpkin and sunflower seeds are good magnesium sources. This snack gives a quick, food-based magnesium boost. If you're considering a supplement, consult your clinician because dosing and interactions matter.
Step by step for the bite. Mix dry ingredients, add the tahini and maple syrup, press into a small mold or roll into bite-sized balls, chill 15 minutes, and enjoy. Keep these in the fridge for up to 4 days. Swap-ins. If seeds aren't available, use oat clusters plus a spoon of pumpkin seed butter. If you have nut allergies, stick with seed butters.
One more caution. If someone has kidney disease or is pregnant and considering significant magnesium supplementation, consult a clinician before increasing intake. Whole food sources are generally safe, but higher dose supplements are not universally appropriate.
All right, friends, segment 6, the guided 6-minute sensory pairing Microprotocol. This is where we lead you step by step so you can follow. Find a comfortable seat, have your cool compress ready, and a timer handy. We'll guide breathing, compress timing, and fingertip pressure. Ready?
Okay. Step 0, place your damp, cooled compress in the fridge or let it sit until comfortably cool. Sit upright with feet on the floor and close your eyes if that's comfortable. We'll start the timer for 6 minutes total.
Step 1. Cool compress for 2 minutes. Gently place the compress across your forehead or the base of your skull. Feel the sensation of cool on the skin. Breathe naturally for the first 30 seconds and notice any immediate change in tension.
Step 2. Two-tone paced breathing for 3 minutes while the compress remains in place. Inhale quietly for a count of 4, breath in through the nose. Hold for a count of 1. Exhale through the mouth for a count of 6, a slightly longer exhale. That's 1 round. We'll do this pattern together for 3 minutes. If counting feels forced, simply make your exhale noticeably longer than your inhale. Begin now. Inhale, 1, 2, 3, 4. Hold. Exhale, 1, 2, 3, 4, 5, 6.
Again, inhale 1, 2, 3, 4. Hold. Exhale 1, 2, 3, 4, 5, 6. Let your shoulders soften each exhale. Keep your focus on the sensation of cool plus the breath for the full 3 minutes. We'll continue. Breathe with me.
Step 3. Fingertip pressure for 30 seconds. After the breathing, remove the compress or keep it if that's comfortable. With relaxed hands, place your fingertips at the base of the skull where you feel that slight hollow behind the ears. Apply gentle, steady pressure, no digging, either alternating or holding evenly for 30 seconds. Breathe normally. Notice any change in tension. If any sharp or increased pain appears, stop immediately.
Now, slowly release the pressure, set your hands in your lap, and take a few normal breaths. Notice what's different. Maybe a little less tightness, maybe just a calmer headspace. That's the point. Small changes add up.
If you have any lingering neck stiffness after this, try the chin tuck and shoulder rolls again gently. But remember, if you get new numbness, weakness, or radiating arm pain, stop self-care and seek professional help. And a quick clinical reminder, if you find you're using these tactics many times a week and the headaches are getting more frequent, track them and see a clinician. Frequent headaches deserve evaluation to rule out medication overuse headache or another cause.
That brings us to our safety wrap and tracking plan. Quick steps to remember. 1. Know the red flags we listed and get urgent care if you hit any of them. 2. Test one tactic at a time. Try this Microprotocol once and log the time, intensity before and after, and what you ate or did that day. 3. Note if anything worsens and stop immediately.
We've put a printable checklist, an allergy swap table, dilution ratios, and a time-stamped companion PDF in the show notes, so you can reference exact steps and our snack recipe. Try one small thing, log it, and see what helps you.
And remember, patch test any topical or essential oil-based mix first. For most listeners, the simple cooled herbal infusion or a plain chilled cloth is both effective and the least risky.
Final medical tip. If you have underlying conditions, bleeding disorders, are on anticoagulants, have recent head or neck injury, are pregnant, or have kidney disease, check with your clinician before trying new supplements or regular NSAID use.
All right, CTA time. We'd love to hear from you. Record a 60-second voice clip telling us which tactic you tried and what changed. Tag @EarthyRemedy on social or upload through the show form, linked in the notes. We might feature stories in a future episode.
Thanks to Dr. Maya, Eli, and Noor, this felt grounded and very doable. If this helped even a little, that's the win. Listen to your body. Trust the earth. Feel the difference.
Subscribe to Earthy Remedy for more practical, safe recipes and microprotocols. We'll have the full recipe card, patch test checklist, and the PDF in the show notes. See you next time.